All right. Hello, everyone. Thank you for coming. I'm going to share my screen with you. For those who are co-hosts, please just let people come in as they come in. Right, thank you again for coming here. We want to welcome you to Community Campus Partnerships for Health Community Forum, co-creating community-centered emergency action plans. My name is Sharice Iglesias. I'm the Training and Resource Director with Community Campus Partnerships for Health. We just want to welcome you to this shared learning space where we can, learn more about community-centered emergency preparedness as well as action plans. And we're just grateful that you're here. We're going to start with a poll, even though there's just a few of us. I want to get to know you all, where you're coming from. Let me launch this poll. If y'all can answer the questions here. What do you hope to learn about today? Just based on, the registration page, the web page. Why are you here? Are you here to learn about respect sites, lesson learned about COVID-19, joining a coalition, or other? Write about it in the chat. Right, so I see we haven't introduced respect sites yet. Yeah, so we have some fabulous people who are going to shed light on that and how you can get engaged, and lessons learned. Joining a coalition, very good. It's a good sign for us because we're here again to share this space about how to create more community-centered emergency preparedness plans, and joining a coalition, right, is a good first step toward getting there. Thanks for participating in that poll. So for those who don't know Community Campus Partnerships for Health, our mission is to promote health equity and social justice through partnerships between communities and academic institutions. And our work aligns with these strategic pillars where we lead authentic and equitable community academic partnership development. We disseminate information and resources. We partner communities with academic institutions, and we provide technical training in developing those community academic partnerships. And these are just some of our partners that we've been working with on and off for the past 25 years. And we really enjoyed working with their expertise as well as their engagement to achieve shared goals together. Okay, so an icebreaker. If in the chat, if you could list your name and pronouns, as well as what's one lesson you learned about pandemic response. And this could be, right, of course, in response to the ongoing COVID-19 pandemic. Just give y'all 30 seconds to a minute. Hi, Anita.
Greetings. I will
Greetings.
complete my response. Good to be here.
Yeah. Anita, would you like to share, not to put you on the spot, but one lesson you learned about pandemic response from your
That
years
it
in
takes
the field?
that it takes a community. No one entity can handle it all, and it takes trust by the community.
Yes, absolutely. Thank you.
You're welcome.
Yes, Paul. Answers are in the community. Pastor Coles, we need people. Absolutely. Starlet, COVID keeps changing. Yes. Keeps evolving, So that means our plans also need to keep evolving as well. Very nice. So please feel free to keep responding to the question. So our agenda for today is to talk about the respect sites. And then we have a community panel. And then we'll learn about community-led action and communication plans, as well as emergency response cycles. So our learning outcomes are to describe the roles of the respect sites in emergency preparedness and to explain the importance of centering historically marginalized communities in action plans before and during pathogen response. So I want to frame this whole, shared learning experience with this really insightful quote by Dr. David Wohl. Outbreaks begin and end in the community, right? Outbreaks begin and end in the community. And what does this really mean? As we know, with the ongoing COVID-19 pandemic, it was the historically marginalized communities, specifically the Black American communities, who were severely negatively impacted by COVID-19, in terms of like barriers to access to healthcare and testing and vaccines and et cetera, which is why we're trying to host, shared learning experiences like these forums, so we can try to avoid that in the next public health crisis. And I feel like a lot of these barriers, right, can be attributed to historical mistrust, that marginalized communities have toward researchers, scientists, institutions in general. So we rely on your expertise as the community partners. So we'd like to ask your insight here in a chat storm. And since there are so few of us, feel free to go off mute, but you're also welcome to write this in the chat. How can we best engage and maintain trust in the communities before outbreaks occur? I'll give y'all 30 seconds to a minute to think of your responses, write it in the chat. And again, feel free to just go off mute.
Rodney Cozy, I truly believe in building relationships and building those relationships before the pandemic or any pandemic. As key is building relationship.
Yes, agreed. Sorry, did someone say something else? Starlet, keep having engaged education events. Yes, absolutely. The more contact, the better. The more communication, the better. Maintain relationships prior to a crisis, right? Because of that historical mistrust is already deeply ingrained, once you arrive, as soon as a crisis starts, the trust is not there. And so, why would they trust you when you're trying to give them like advice on things? Yeah, value the contributions of communities and allow them to develop ownership with major activities. Nice. Awesome. Thank you all for sharing your ideas and your insights. Support community-based organizations and their projects. Yeah, exactly, Paul, which is exactly what CCPH does. So shout out to them. But I am going to pass it on to the UNC team to introduce the respect sites. So yes, Billy, please take it away.
Great. Thanks so much. So I think maybe the best way to start is just to introduce myself a little bit and tell you a little bit about what we're doing. My name is Billy Fisher. I am a pulmonary and critical care physician at the University of North Carolina. So basically, I take care of really sick patients who are on life support. But I also have this other role in my career, and that's to respond to outbreaks. And so I work with the Health Emergencies Program at the World Health Organization. And over the past 10 years, have been sent into outbreaks of Ebola virus disease in West Africa, so Liberia and Guinea, in the Democratic Republic of Congo, and then most recently in Uganda in October about a year ago. And I'm sent in to provide direct care to patients with Ebola virus disease, as well as other severe viral infections such as Lassa fever. And then I'm also there to help bring in new treatments, really try to bring in better supportive care and better therapeutics. And through those experiences, have really learned that we can bring in all of these fancy and new exciting tools. But the outbreaks don't end with the new therapeutics and the new vaccines. They really end with engagements with the communities. And so that's really part of the reason that we're here today. And one of my jobs today is to introduce you to the idea of the RESPECT project. And that's RESPECT stands for Regional Emerging Special Pathogen Treatment Center. And it's I co-direct one of these centers at the University of North Carolina with my colleague Dr. David Wall, who's on the call as well. And really, the bulk of the work is led by Brooke Brewer, who is a nurse that leads our program. And what the RESPECTs are they are centers that are located across the United States, and they're designed to really try to enhance our preparedness for outbreaks of some of these really scary infectious diseases. And the goal is to enhance that preparedness so that we can respond better, to provide direct patient care to patients who might be infected with one of these pathogens, to increase the training so that we're all a little bit prepared ahead of time, but and then also to think about how do we learn from outbreaks of the past, COVID, Mpox, influenza outbreaks, and how do we correct some of the wrongs of these prior responses? How do we improve access, not just to therapeutics, but also to diagnostics, to vaccines, to reliable information, public health information, so that we can protect not only ourselves, but each other. And so I think that gets to a lot of the comments that have been included in the chat about about improving communication. One of the thoughts that we've had throughout this process is to do this before the emergency happens. We've always learned that if we respond only when an emergency is on site, it stresses the attempt to develop the trust that's needed between the providers and the community. And it really, I think, in many ways, it excludes the community, which from being part of the response. And so I think one of the things that we're hoping to do today is start to think about engaging with different communities across the United States to strengthen our response, but also to strengthen our recovery. As we go through these events, I think incorporating recovery into the response effort, I think, is going to be important as well. Next slide, please. All right, wonderful. So there are 13 U.S. regional emerging special pathogen treatment centers located across the United States. And these are strategically positioned to cover specific regions within the United States. UNC, MedStar Washington Hospital, and Corewell Health are three of the newest sites. They were added in 2022. Before that, we had 10 that were in existence since around about 2015. Now, you may have heard of some of these sites for their role in providing care to patients with Ebola virus disease, in particular, Emory University, University of Nebraska Medical Center, and then Bellevue Hospital up in New York were, I think, really important centers during the outbreak in 2014, when individuals were brought back to the United States for care or identified who having returned from the affected countries, and they were able to get really good care at these sites that were prepared. And so over the past year, ASPR and HHS have expanded the number of these treatment facilities to do just that, to strengthen the preparedness across the United States. Next slide, please. Now, you may ask the question, well, why do we need these RESPECTs? And I think hopefully over the past 20 years, we have seen an unfortunate increase in the number of emerging pathogens, the size of outbreaks, and really the geographic involvement of the globe. Just want to point out a couple of these. Over the past 20 years, we've seen emergence of 3 coronaviruses that have threatened public health. That includes SARS back in 2002, MERS, which is a Middle Eastern respiratory syndrome coronavirus that emerged in 2012, and then unfortunately, most recently, COVID-19. But there's other viruses that I think are worth that we have to be really prepared for. We've seen an increasing number and size of Ebola virus outbreaks. including across West Africa, Central Africa, and more recently in Uganda. We've also seen the emergence of many different strains of influenza virus, including avian influenza viruses within animal populations really across the globe recently. And so I think what we're trying to do is build the preparedness so that our response is informed by the community and is prepared to not only provide care, but also prevent transmission. Next slide, please. Okay, so this is a slide that highlights the role of these regional emerging special pathogen treatment centers. And really the idea is that they serve as leaders, as leading providers of care to patients who may be infected with one of these. And they improve the overall healthcare system preparedness for emerging special pathogens. The 13 centers are hospitals with enhanced capabilities and capacity to provide direct patient care to patients with highly infectious diseases. So this is really preparedness in advance of an event. They also play a role in acting as regional hubs for preparedness, so helping each region develop plans for transportation of identifying individuals, transportation to a treatment center, and then providing care to those individuals. Increasing the increasing the provider preparedness through training events throughout the country, and then also developing a research capacity so that we can learn while we provide care. And I think learning is going to be a really important aspect of the work that we do, because we know that, as somebody mentioned in the chat, COVID kept changing and it continues to change. And as it changed, I think our response needs to change. And so having a research part of this effort, I think, will be important to make sure that we continue to learn as we provide care. Next slide, please. Okay, so this is the structure of the HHS regions. They're all divided into numbers. UNC is located with Emory in Region 4, which is the red color in the southeast. And so we will collaboratively work with Emory to build the preparedness within the southeastern region. And then other sites have been designated as the respect sites for each particular region across this map. Next slide. All right, I'm going to stop there. Happy to pass it back to Charisse or David. Jump in if you have any other comments to add.
Okay, yeah. Go ahead.
No, you're good. Thank you.
Okay. Well, thank you for sharing that information on the respect sites. If there's any questions for William or David, please feel free to ask those in the chat. We can address those as well. Next, we're going to get into our guest speaker panel. So first we have Shemecka McNeil, from Executive Director and a founder of Slice 325, Reverend Dr. Rodney Cole Sr., who is the president and founder Church's Outreach Network Interfaith Clergy, and Dr. Lisa Paulin, who is the Associate Professor of Mass Communication, North Carolina Central University. So how this is going to work, we're just going to ask a few questions, and the participants, if you have any questions for the guest speakers, please feel free to put those in the chat. But I'm going to ask the first question now. So what's one or two most important things you did to help address COVID-19 in your community?
We just speak.
Yes, whoever has the first answer, go ahead and address it, please.
One of the things that we did was to make sure that the information that we were presenting was correct. We did a lot of research. We spoke with a lot of doctors. We were on a lot of panels and things like that, because having the community trust us was a key. So we want to make sure what we said was correct, since we are kind of like the frontline workers. If something comes back and it's not correct, the researchers are not going to get it. We're going to get it. And we want to still be trustworthy in the community and let them know that we care about, their health and to stop the spread, because we lost a lot of loved ones and things like that. So we want to keep them safe and healthy. So the first thing that we did was make sure that the information that we put out was correct, and also had like an open door policy. We didn't care if you asked us the same question 100 times. We were going to answer them 100 times to make sure that they were correct. And we absolutely appreciated some of the fact finders, some of those people that went all the way down the rabbit hole, and kind of took the myths out of that and put it with facts. So that's what we did.
Great, thank you.
I would say that, I have a couple roles as a professor or whatever, but I was a member of North Carolina Central University's Accord team. And what we did, as soon as we got, there was the CARES Act funding, and the UNC system was the UNC was going to get most of it. And the historically minority serving committee or coalition in the legislature is the one that said, hold up, $6 million of that needs to go to HBCUs. And so we were at NCCU, we were able to get, some of it. And with that, we created the Advanced Center for COVID related disparities research. But what we did literally was we went to communities, we went to church parking lots, we offered testing events from, at the beginning at least, and met people where they were and held testing. And I can show you I'll quickly show you a couple other things we did. We decided we wanted to create a newsletter, like a vaccine report, to keep people updated. But the main thing was truthful information, but written in a way that everyday people can understand it. And I can tell you right now, this one about the mRNA vaccines, this is one of the ones I wrote. And, the scientists on our team were like, I'm really curious to see how you are going to explain mRNA, vaccines, but, other people don't understand things the way that the scientists do. Later, as the pandemic was really ending, we created a coloring book that has been disseminated a lot. And then we also ran focus groups to get people's reactions to it. And it's available. I can share the links. It's available on the CCPH website. I'm not going to go through it all, of course. And you can see that the page numbers down at the bottom, we've got like page 1 and page 10, because when you print it out, you can use it like a book. So the pages online, it doesn't read as well. And then, we opened we have some social media sites that we try to share things on. We created some video, we've done some webinars. We've created a couple videos, one that explains clinical trials, and then some in Spanish and English, but mainly directed to the Latino community. So I will stop sharing all of that right now. And let's see, were you able to see those or not? Did I actually share? Oh, no. All right, hold on one second. Let me try that again real quickly. But while I won't say the same things over again, but what I will say is that, with the newsletter, we loved the idea of the newsletter. And, people at churches in, very rural areas, or not even rural areas, but outside in Cabarrus County, in the counties that had greater health disparities, they really liked them. And the pastors wanted us to bring them, and we went, but by the time everything was changing so fast that we couldn't keep up. So by the time, we wrote the first newsletter, and then we had the scientists review it to make sure we were being accurate. Then it was who's going to get it first. And then by the time it was ready to be printed, I know that what we learned is a little bit later, but, there are a lot of communities that don't, they need print information still. There's limited access to the internet, or poor access, or unreliable, or and so we've still found a lot of people asking us for print materials, but now it's more stable. So it should be better. This is our YouTube page with some of our the video here, as well as the cartoon animations that we've made. And I won't show the others, so in the interest of time, so someone else can speak.
Just real quick, here in 2016, Matthew had came through our area. So the Interfaith Clergy we had put together was called the Pitt County Resource Recovery Team. So that it was already growing up with a lot of partnership. Yeah, we have the newspaper and as well as the TV station on our board, and we had all the different agencies, Night Away, we had Legal Aid, we had Catholic Charity, Food Bank, all in one area. So we already been doing e-blast for the last 19 years, all information that goes out. So to update the community as we received it, it was easy to update the community because we have these resources already given to them. This and it still goes on today regarding of health or what else is happening, sweet potatoes dropping in different locations. So we already have put in place and to build that kind of relationship a while back. And all funds that we will receive, it goes to a Night Away. And then as the team, we decide how we work it in those areas. And we contract Catholic Charity. But to get back to COVID, when that came down, we was kind of already kind of prepared for that. To be able to get the information out. We also work with Feed the Children in different areas. We actually handle about 14 counties. So we was able to get, I didn't know who Joe Gibbs was, and he came down. He owns a NASCAR racer. I didn't know who he was. I didn't know nothing about sports. But he said he took care of 5 tractor trailers to come down for us. And so those are the type of things we was doing, those who needed food, and find out what area, because one side didn't fit all, see what they had the need for. I pause there. I'm going to be too long-winded.
Thank you. Yes, I know language equity is an important thing to address when thinking about COVID-19 and other emerging pathogens. And so I want to go on to the next question as far as going a little bit off script, as far as addressing the social determinants of health and like how you, given the historical legacies in marginalized communities, how have you addressed those in communication ways to community members about, you know, the distrust between government officials and the community, past incidents regarding vaccines and medicine in general? So how have you addressed those concerns within the community members that you serve?
If I mind going first, we actually had the hospital, we got with our president, and we had the folks that was in our hospital. This is ECU. They changed the name so many times. I've been here 19 years, they changed 3 times. But we had education training to them, those do virtue. And it was a concern. I mean, was it going to get, are we getting sick from these vaccines? We had a very hard problems at one time getting African-American men to take the shot. So, and that's what we work with the 100 Black men we have here. I'm a part of them to kind of get the men's, and we do a lot with our men groups here, men health, men mentoring, and that was one of the key things, but it was the education component to explain to them, you know, and then that's kind of, we actually got it through, but it wasn't easy. It was pulling an elephant up a hill with one hand.
Thank you. Does anyone else want to address that question?
I'm just gonna put myself sorry. He kind of took my, but it said like I'm like the same thing that we did, just about. We just wanted to make sure everything was right, everybody was served equally, didn't want to miss any community or anything like that. Like I said, if they had questions, we answered them. We were on the ground rolling, things like that. So me and Reverend Rodney was on the same page.
Nice. Okay.
I'm sorry, can you I was trying to put things into the chat and I'm kind of missed the exact question. What was it again?
Oh, no problem. Just how have you addressed the social determinants of health and the historical legacies that have presented within your community?
Yeah, I think, I mean, that's something we're still working on. At first we were, so COVID focused, and we began kind of because of COVID. But listening to people, I think, is one of the things, is, bi-directional communication. So, not just going in and telling people what they should do, but asking, what are you doing well? And what can you share with other people? And, and just trying to target things that they are concerned about.
Yeah, thank you. How have you guys centered equity in your work when engaging with community partners?
That one, we asked to see, what is it that you need? Do you have the things that you need? And if you don't have the things that you need, let us know so we can get you the things that you need. Or as far as like resources, or who to talk to, or where to go, and things like that. But we found that a lot of people didn't know certain resources were out there. A lot of people didn't know that they were maybe going to Henderson or somewhere else outside of their county, and things that they needed was right behind them. So we used NC Care 360 for a lot of things, and that helped kind of bridge the gap for finding the resources to get equity, health equity, and things like that they needed.
Nice.
I can say one of the interesting things that we did in terms of research perspective, and was that when we were doing all the COVID testing in these communities, we also did surveys, and on the ground, pencil and paper surveys while they were waiting in line for their COVID test. A lot of, we were able to collect like almost 1,300 surveys. And then we were able to kind of look at what we found in terms of, who do you trust for information? How likely are you to get the vaccine when it comes out? It didn't necessarily match the national data that was coming out. And so I think we were able to show as a group that, that in those national surveys that are online or telephone, they're not reflecting everyone. And that there's still value in, doing things in a non-technological way to find out information, especially from the people who really are, suffering, or the counties that had the biggest hospitalization, infection, and death rates.
Okay.
Yeah, is the key of the need as and the resource. The team, we have it called Community Unity Network, been in existence since 15, and that same system that we was using before, any disasters or finding the help, and that's how we do our client intakes. I mean, if somebody's in Walmart and they needed some type of service, and our website is, I'll put it in the chat, but you can do that right there, and we'll find out. We've been using Charity Tracker for our data to find out who we help, and we had them to fly out in 2016 to talk about their programs, and we actually have it in a lot of areas in the churches, United Way, Salvation Army, and so we kind of communicate through that on a resource. So by having a resource and what they need, whether they need food, whether they need diapers, I mean, we work with seniors and it goes on, but that intake was the key thing to finding what they need, and that built a lot of relationship through the community. I always believe that a personal touch is better than a preaching word. So I am out there with them, and everyone has my cell number to call me. I don't think nobody's better than nobody else. So I'm always in other pastors, and when they see me out there, everybody else, they get involved. So we call Churches Outreach Network is one name. That's dealing with Christian, but we have the Interfaith Clergy, and that's the other religious. So we all come together. We all God's children. And I pause there.
Nice. Thank you. Yes, I know, even when thinking about, even kind of going back to the social determinants of health and thinking about, especially during COVID-19, there's a lot of transportation issues given access to vaccines, housing, food access, healthcare, and touching on those those determinants all at once you'll see can bring upward mobility within these communities that you're serving. And knowing that partnerships or even outbreaks start and end within the community, how important is it to center community partnerships and community engagement within your work so that, you know, you are centering the voices of the community to eventually mitigate the spread of COVID-19, address any issues, any barriers that you're seeing? So how important is community engagement within that process?
Partnership is very important. As we have heard this many times, no man is an island by itself. And I would say that the Lone Ranger does need Tonto. You know, we can't do these things, but as a partnership is so important in connecting with the right people, working together. And I say this, that using our gifts and talent that we have already is here for us to use for ministries to help others. It's not for us to take this back with us where we came from. So, I mean, it's very important on partnerships is always about a we. When the person about talking about I did this, that's when I start to run like Forrest Gump. But my key thing right now, how do we work together and partnership? Everything's about partnership. It's nothing that we have. There's nothing that came into even on the warehouse that we have. It's 75,000 square feet, big warehouse. You get shirt plan, and we get products that come in. And I always tell people, what's in that facility is yours too. And we give it. And I'm not a food police. I'm not a toy police when we do toys. I am not chemicals and police. I trust the folks to do what is right and work with them. So partnership, I would not be where I'm at today without the partnership, that the people that works together and how we work together and share. And that's why I will leave it at.
Thank you.
If you don't mind, Lisa, I'm sorry, my power glitched and everything went out. Could you repeat the question for me?
Yes. Basically, how important, since COVID-19 started and ended within the community, how important is it to engage community partnerships when you're addressing COVID-19 or other emerging pathogens that might arise within your community?
With partnerships, we kind of took partnerships a step forward by not just partnering with community organizations, but partnering with community members in the community. And I say that because we can go to another organization to get supplies or things that we like say, hey, we have this, but we need this. Can we, because we love the barter system, could we barter with this, or could you help us out with this? But Miss Louise in the community knows everybody's business. She knows who needs this, who does this, who's in the hospital and everything like that. So you may want to partner with a community, and I say one of the community hierarchies or matriarchs in the community to help you with that, because she's not going to tell you anything unless you trust you, because you're kind of like an outsider if you didn't really were born and bred there or whatnot. But when community members or partnering with community members see that you are really, really like true to what you say, want to help and things like that, that helps you as an organization grow also, because they tell other community members about you. So now you become a trusted organization in the community. So it's just not, hey, we're partnering with Duke, or hey, we're partnering with Reverend Rodney and things like that. We also partner with people that are in the community that community members trust.
Gotcha. That makes sense. Thank you. I did have a follow-up question to that. How would you, let's see, when thinking about these academic institutions or any other government institutions, when they come to ask for a partnership or to collaborate on something, what measures do you take to see, okay, I can trust this person to work within our community, to do X, Y, and Z within the community? What is that process like when trusting someone outside of your community?
With us, that process looks like, are you going to go out with us? not just sit behind a computer and tell us, hey, we found this research, that. Would you have one of your research partners come out with us to the community? So it's just not our face, it's your all's face too, because we are getting the information from you. And if we trust you, we want them to see who we trust, just in case we have to come back. If we receive a question that we don't understand or really not sure of, it's like, hey, you remember such and such that was with us from UNC or NCCU or this, that, and other. Well, we're working with them. So let me go ask them, because now they have a face and they don't think that them is just somebody that I conjured up in the air or whatnot. It shows them that we are serious about what we're doing, and them, the academic institution, is serious about the community too. So that's how we kind of weed out who we're going to work with or collaborate with, because you all need this data to help us, and we want you to help us, but we also want you to see, because there's no better education than to be hands-on. So you can see what's going on and what the community needs, instead of just looking at some data because maybe this area looked kind of sketchy and someone was scared to go out there, versus it's not really that scary. They just don't know you and you don't know them. So we also created lunch and learns, where we brought food out to the community, and not just gave it out, but we actually sat down and had a lunch with them and had say, hey, what do you need now? We can't promise you the rainbow, but we can say, okay, we can go back and take these to this grievance to whoever, and then we'll come back and we'll give you the information that they gave us. Now, we can't make everybody happy. We can't give any promises, and that's something that we don't do, is give promises, because we have to stand on our promises, but they know that we're out there working with them, for them, excuse me.
Thank you.
I mean, I would say she's 100% right. I mean, there's two types of people. There's people who are doers and there's people undoers. You would know the difference. People that is available, they're not capable. Okay? People that is capable, we're not available. So you work on our availability, and you would know them by the Spirit, because you would see where they're working really to go into the ditch and work with you. So, I mean, you would know them. Some people are dreamers. There's nothing wrong in dreaming. Just call me when you wake up. But we got work to do. I mean, so working with people after years and years working, you get to know them, whether they want to work with you or not. The heart doesn't move what the eyes doesn't see. When people see you out there, they see you working, they see your connection, and it's a spirit. It's an embrace spirit. It's just like a child. The child will either embrace you, and if you can pretend that you're nice and you got a mask on because of us, the child will not even come towards you. And that's the same thing as working with others. I mean, there's some people would do, some people don't want to do, some people just want to be at the table. And in some cases, you need to remove them from the table. So, I mean, there's a give and take here and who you need to work with. Finding people that is capable and as well as available.
The only thing I would add that's maybe a little bit different from what my colleagues already said is that we're at the point now, I mean, now that pandemic is gone, but we're at the point now where we're trying to do more to teach people so that they can teach others rather than just responding to their needs and, listening and, that the other type of being there and being present. And, I mean, one example is for the NC SEAL, there's a year 3 survey, and the person who's working on that has asked our coalition members across the state, like, hey, are there any questions that you have about things in your community that you want us to put on the survey? And with the goal of, we will then share that back with you. You don't have to write it in a survey question, just tell us the topic, we'll write it, we'll check with you, and then also we'll give you back the information, and we'll start trying to do some workshops or teach you how to apply for grants, other grants yourself, because anytime you can show some numbers, that's data, and that's like a different way that we want to help them. My personal thing that I really want to do is teach people how to identify misinformation, and not just that, but how to have the confidence to tell other people when something is not accurate. Because I think sometimes that's a little, especially on social media, I notice our students, when we've talked with them about sharing information about COVID or health, they're like, yeah, I'm not going to go there. I don't share that. I just share funny things and so, to give them some tools to feel confident to be able to say, I'm not sure that's, or where did you hear that? Whatever, but to feel confident about that too.
Yeah. Thank you. There was a question in the chat, I think towards Reverend Rodney Coles, about when you talk about the different religious affiliations that you are working with. The question was, what about people who are not religious? I'm thinking of communities that we may perceive as unsafe or difficult to reach.
Let me share this. There's some things that separate us from what we need to do. I will use what the world used, and I will use what Satan did. What the world used is political, religious, and the color of your skin. What Satan uses money, drugs, and sex. So my whole key thing, none of them is interfere what we need to do to help somebody. So it doesn't matter whether the religious or not. I mean, if somebody needs something to eat, you're gonna feed them. Somebody needs that resource. We don't try to preach the gospel to people. We don't do that. And we try to let them see our hearts and what we're doing and talk with them like they're human beings. Again, that moves them. You don't have to say much, but if they're not religious, it's fine. It's not what we're concerned now. We're not asking who's Pentecostals, we're not asking that. To me, those are the things that separate us of getting really the work done. That's the biggest separation, is those three. 3 on the left, 3 on the right. The world, what Satan put into us.
Thank you.
Yeah, and I would kind of like to piggyback off of what Reverend Rodney said. We have found in some organizations and some people who want to help, even down to volunteers. In a nutshell, some people don't know how to talk to people, and that causes a problem. And I tell them, you kind of want to lead with emotional intelligence. And a lot of people don't have that. And I think that should be a class that should be taught to people who come into organizations, because we do it in ours, to come in organizations, because you have to know your audience. The way I talk to doctors is not how I talk to community members. So it's a bilingual in another sense. The way I talk to this person may not be the same way I talk to this person, but the message is still getting across. Instead of like Miss Lisa said, she wrote papers to kind of condense it a little bit so people can understand it. And a lot of people don't see it that way because they're just so focused on the research and like, okay, well, they don't understand this. Well, maybe they'll Google the word or whatever. But if you got a one pager with 11-inch font and it's going all the way down, and you have Miss Pearl over here that has bifocals and things like that and don't quite understand it, she's going to take that paper and just throw it away. Or if you just throw out words to her, like she said, understanding COVID and like some of the antigens and things like that, they're not going to know that if they don't have a medical background. So you kind of have to break it down to them and know how to relay that message. And if you don't know, get somebody who do know so you can tell it to them, so they can tell it to them, tell it to the masters or whoever needs to be told. Because if you just start talking at people instead of to people, then that causes a problem.
Exactly. We have another question in the chat. So how did you handle communicating uncertainty or correcting advice when new information became available?
I mean, like I mentioned, our newsletter, it was tough we didn't make one after that one because things were changing so quickly, and we learned that it was almost impossible. One thing I wish that had been kind of done in the media, as well as like kind of like just the way to frame the narrative, the way to talk about it, would have been to just constantly be saying, we don't know, things are changing. we'll update it, quickly, because I felt like there were a lot of people who are like, well, how can I trust them? They were telling me I needed to sanitize my groceries, and now it turns out I don't need to. But I think, just a message of, what, we're all in here trying to learn what we can, and change occurs, and things change, and you move along as you learn new things, and just to make that a normal part of the conversation, to hopefully avoid some of the well, they don't even know what they're talking about, because
yeah, I think there was a lot of frustration that came up when there was a lot of going back and forth on information. So I think definitely transparency needs to occur, where it's like, hey, we're learning about this too. This is new to all of us. Please bear with us as we put in information out there. Whether it's, what we say right now could be different from tomorrow or next week, but having that transparency, because there was a lot of frustration going back and forth from information.
I have an example of that I thought was too cute. When it first came out, someone was saying, oh, well, they just injecting you with a microchip or some type of antibodies or whatever, and they'll find out where you are and this, that, and other. And I said, I see your point, but do you have a smartphone? Do you have a Roku television? Yeah. They already know where you are. So that is misinformation. I said, and please don't get me on TSA pre-check. If you travel, they know exactly where you are, where you're going to be. So it kind of really? And that kind of took the stigma out of that. And that goes back to knowing how to talk to people instead of just coming at them and say, well, why would you think that? That's so stupid. Who would it? It's not this, that, and other. Like, baby, they already know where you are if they want to come get you. So this shot doesn't have anything to do with someone looking for you. I guarantee you have a social security number, they're going to find you. So that part took a lot of the stigma out of the community that we worked in, of thinking that everybody's trying to track them because of the shot.
I think Shemecka's example is great, because it also illustrates the impact that humor can have. And I think we haven't done enough, the ad council ads about, being, you don't have to be a perfect parent to be a foster parent, and all of their different campaigns about, buzz driving is drunk driving. And I feel like either we've missed it, or, finding a way. It was hard to laugh at things during COVID, but I think humor is a really important tool that can be used.
Mm-hmm.
Yeah, communication is one of the key things. Is building that communication with them. To me, was something that we done, is build those communication. It's just education is so important, and I always, as the COVID came through, let's educate the people. As we know, Scripture said, "My people are destroyed because of a lack of, knowledge." Educate them. And sometimes you have humans, but when the $1,400 came through, I don't think they rejected that. You understand, when they all got that fundings. So it was, how do we really work with them? I mean, the money they received, but the COVID, did it help them to be better? It was a different thing. So once we educate them and had the conversation with them, and some say yeah, and some say no. You don't push people into they feel that they want to do. I don't think that I never force. As many times of service I got to go, I never force my wife to go to all of them. Sometimes she said, I don't feel like going. I said, well, I'll see when I get home. And that's, you don't force people. You just let them do, and it comes on to them to do that. Don't ever force people to do something. Just give them education, and sometimes when they receive it, might be 2 weeks later. And that's kind of how it went.
Mm-hmm. We have another comment for you. Spirituality played a very important role in holding the community together. At the South Asian Worker Center, we conducted Zoom prayers, meeting among different religious groups. We had priests from temple, church, mosque, and other who all were interested. Reverend, would you like to share some of those experiences in your area? We call this spirituality and well-being.
Well, I could go into a whole lesson with just not a one part I can come out with. Is dealing with a religious spirit that they deal with is it could be anywhere from what a person thinks at that time. Uh, it's not a short answer for that, to really to answer that question. It would have to be some level of understanding of that before I go there. But I think that as we working with any any religious in the spirit of what they feel, there's certain things they do. It's just so much. You're pushing me in the area. There's so much in that there that I would love to speak about, because when understanding what we're supposed to do in the spirit and different things is that that's a force. I can't even answer that on a 5 minutes. I mean, I would have to give the breakdown to you for that. I mean, even with churches, I have to give you the breakdown. Why do the churches and the different names? I mean, there's a whole list on that there, Pentecostal and all that other stuff.
Thank you.
I would like to add something, if that's okay. I did a focus group with African American pastors of churches in Durham and a little bit outside of Durham too, when COVID was going on, about what they were dealing with. And there were a couple things that stuck with me. I mean, they were amazing at how, I mean, they all had different approaches about how they, were still serve their congregation in, Facebook. We do Facebook Live. Oh, everyone comes and we have a radio station and they sit in their cars in the parking lot and we broadcast it. So we're still kind of together, recording things and they were amazing, and how they were able to teach some of their congregants, who didn't have some skills. So they formed partnerships with the younger people, teaching the older people, and they also provided just a phone number you could call in and listen if you just did not want to even learn the technology to be able to watch and attend online. So that was one thing that struck me, was how creative and how dedicated they were at finding a way, and the tremendous stress and pressure that leaders of faith communities went through. A big part of their ministry is helping people transition with death, working with families, and they couldn't go, and they were talking to family members who couldn't go visit their loved ones in the hospital, and they couldn't do funerals. And, it was that, and on top of that, wanting to inform people, but not always being sure about that the information that they were getting was accurate. And they didn't want to share it if they weren't 100% sure, but at the same time, so they played such an important role. And, I think we need to acknowledge also, that, a lot of the pastors that I talked to, and they were from different denominations, they said, it's not like I'm trying to take people from your church, we're not competing, we got to help each other out and stand up with each other.
Mm-hmm.
I'm going to add one to that too. Go ahead, Mister. Go ahead, Reverend.
Yeah, I just want to add real quick. Yeah, when it comes to pastors, there's a lot of burnouts that have been going on previously, and in some areas, some have been called into give the message, and some have called themselves. So you're dealing with a mix of certain people. You're dealing with sometimes on the mix of, but those truly they don't have understand what the word really means, interpret it. Sometimes but when it comes down to suicide, you have more pastors you may not even hear about it, but that's what they're going through. With the mental health is number one with them as they're going to with pastors. But as a study says, is basically senior citizens. But there's some areas in there, but getting them together, having a conversation, and focus on that, because we often think differently. Some believe in the COVID shot, some don't. Now you go into the LGBTQ. There's so many layers on that. I can go over female preacher, but different layers, that they see certain things and how they feel, But so I mean let me pause there because that's an area. I'm a person in history and looking, understanding, and deep down to the question and knowing that there was not just 10 commandment that was giving was 613, and first it was in Genesis. I mean, it's just they don't read into that. And they don't read all the list. Some people just get up and buy a collared shirt and they jump up there. You don't know what they're saying and what direction they're going. But let me pause there because you got me in another area. I'm gonna pull back.
Thank you, guys. We're gonna move on to the next section. Thank you guys for sharing all that insightful information with us. And then yes, Sharice can pull up the next one. Okay. So moving into community-led action and communications plans. So just what is the purpose of an action plan? It basically is to clarify what resources are required to reach the goal and formulate a timeline for when specific tasks need to be completed. So it's necessary to determine organization's mission, vision, and goals. And so we saw that communities of color were most impacted by COVID-19 due to structural racism and other determinants of health that are often ignored and neglected. So to adequately address these factors, we must consider the community's role and highlight their voices and what they identify as needs and the impact it has on the spread of emerging pathogens. There needs to be an action plan implemented that addresses the steps that need to be taken when faced with a new pathogen and who all are the stakeholders that are involved when reaching the goals of these action plans. You can include community-based organizations, grassroots organizations, faith-based, and other non-traditional organizations, for example, like homeless shelters. And so with that, later on, we'll show you a template of a community action plan, and we'll go by each cycle of the community response for what communities need to do or how to engage communities with the respect sites and in general. So next slide, please. So we have the emergency response cycle. So there are 4 components to emergency response cycle: mitigation, preparing, responding, and recovering. All of these, to be done well, need to be rooted in strong partnerships between communities and institutions addressing the emergency. Next slide.
And if I could jump in real quick,
Go ahead.
Keisha. So the idea of action plans for to be prepared for an emergency, this is something that can be done at a lot of scales. And so this is definitely something that an individual organization or neighborhood or city can do. What we're going to do today is a little bit of an exercise that's part of a bigger effort to really put our heads together and think about what kind of action plans should we be collectively designing as we prepare, as the respect sites are doing for possible future pathogens. So we're going to go through this, and rather than doing separate sort of action planning and thinking about that, we want to draw on all of your knowledge, the knowledge that we just got from those talks, from everything you've experienced, and think a little bit about what are some of the key aspects that should be in our collective planning as we move forward. And it's not just, we'll be having multiple of these events and bringing more and more knowledge and wisdom and experience to the table. So we'll just be walking through each of the steps a little bit, with Keisha talking about what the step is. And then I'll be encouraging you all to share ideas, even if you've shared them already, to really get them in this discussion. And we're going to be gathering all of this, and you'll be able to see some results of our conversations down the line.
Thank you. Okay. So for community partnerships, they're crucial for controlling disease outbreak and mitigating disasters. So using the health promotion strategy of strengthening community action enhances the opportunity for better outcomes. So as we engage with communities and listen to their identified needs and desires and what actions need to be taken to address their goals, it will result in better outcomes. There needs to be improving understanding of community engagement practices before, during, and after a crisis to bolster community engagement and support. Community-centered approaches focus on objectives such as building the community's capacities to address social determinants of health, facilitating multi-sectoral collaboration, deepening access to community resources and information, and also facilitating opportunities for civic participation as a means for promoting health. And so, some successful partnerships are relationship-centered and not transactional. So you need to figure out what is the common interest or issue that brings you together. Partnership should be win-win, so not one that benefits one but sacrifices another. You need to acknowledge the power dynamics, knowing that researchers are not coming in to, knowing all when they're collaborating with partnerships, but having that shared collaboration and knowing that community partners are the experts when identifying these needs. And it's nothing about us without us. So you really need to stay on the premise of community engagement and partnerships and health equity. And transparency builds trust, as does being open to feedback as well. And so then I'll pass it on to Paul to explain further.
So our question, this is at the core of our model is community partnerships. We're going to drive all this other work. Based on our discussion today and everything that you know, what are some of the key actions that need to be taken to make sure we have the partnerships that we need to address any emerging pathogen in the future? What are some of the key actions that need to be taken to ensure that we have the community partnerships we need to address emerging pathogens in the future? And just please throw some answers into the chat or jump on and just say it out loud.
Well, you asked the question, what is some of the key things to have a partnership? Paul, let me make sure I got this correctly.
Yeah, what are some of the key actions we may need to take to make sure that we build those partnerships that are gonna sustain this work?
Well, the first thing I would say what was done with us is having an MOU done to find out what you're looking for the partners and which the partners looking from you. That's going to build the first step to me, and that's how we do things here.
Thank you. Everyone else on the call, what are some of the key actions that need to happen to make sure that we're building those partnerships?
This is Anita. I think just as we do clinical diagnosis, those who do clinical care perform clinical diagnosis, I think we also need to diagnose the community, looking at the demographics, looking at the power structure, looking at who communicates with whom, who are the key stakeholders, as well as to do to map the assets of the community as part of that process. So we have the information we need to be more efficient and effective in what we do.
Thank you.
Can I jump in? Hi, my name is Cheryl Jones. I think that we have to define partnership, because I think oftentimes when we go into community, I do community-based participatory research. We go into community with the idea that we know what the community needs, even though we say we're looking for them to be our partner. So if we're saying we're going in to assess a community to see what they need, we really need to look at someone from the community, or an organization from the community, a group of people from the community that we actually look at as our equals. The data, the information that they have is just as valuable as the science we know. And I think developing those kinds of partnerships are what's critical. And I mean, partnerships look different. So I guess we would need to define in what areas we would have those kind of equal partnerships, which does address issues around equity and inclusion. And then we also need to look at those areas where we need to be more directive. So I think us defining what we really want in these partnerships is critical, and to identify what those partnerships will yield, or what we want them to yield.
Thank you. Shemecka?
Yeah, I wanted to kind of piggyback off of what she said, because recently I had to help somebody understand what we're just talking about. And the way we put it was, you say that you want to partner with people, you don't really know how you want to partner or what you want to partner with. So that's like getting Microsoft to say, hey, I need a system. Could you help me with it? and you didn't give them any data. So Microsoft said, okay, this is the program that we think you may need, instead of asking us what we need. So when the main thing is you need to talk to the community to see what they need. And if you need a translator to translate it to, and I'm just going to use as an example, to the engineers to create a plan of action of what they need instead of what they think they need. And then they kind of like, oh, okay, we got it. So we need to ask. And then translate it to this is what to the person who knows how to create these plans, to say, hey, this is the plan that we received from the community, and this is what they said that they needed, not what we think that they need, if that makes sense.
Yeah, absolutely. Thank you. Why don't we go on to the next step?
Well, I might just jump in if that's okay.
Yeah.
And I would offer something not, I think I'm learning more than I am providing any kind of information, but I think transparency is something that has helped us in the past in outbreaks of Ebola. One of the big problems is that originally they used to set up gates around the treatment unit. And so you couldn't see in and you couldn't see out. And that affected us really detrimentally on both sides. The community didn't know what was happening on the inside. And the patients were suffering because they couldn't communicate with their loved ones. And once we were able to take those down and design better treatment facilities that allowed complete visualization of what was happening back there, it was amazing what the community, how engaged they became in the healing process. Patients did better, they felt better, and the community supported the providers. And so I think transparency has a really important role here. And I think it means different things in different outbreaks, different settings. But yeah, thanks.
Thank you. So now we're going to go on to mitigation. So mitigation measures that prevent an emergency, reduce the chance of an emergency happening, or reduce the damaging effects of unavoidable emergencies. So mitigation planning reduces the loss of life by minimizing the impact of pathogens, emergencies, and disasters. It begins with state, tribal, and local governments in identifying potential emerging pathogens and other viruses and their risk, mainly and commonly targeted to marginalized communities, as we have seen with COVID-19. And so identifying these risks, the development of short and long-term strategies for protecting people and communities from similar events. So that is when action plans can come into use. There are keys to breaking the cycle of emerging pathogen damage and reconstruction. So it is definitely vital to incorporate the community when thinking about how to reduce the risk and harm of the virus, especially since it's affecting their people, because they know best when it comes to their own community. And some examples of activities that we can include to stop the mitigation is we're using community action plan, community engagement, accurate information, and then recognition of historical legacies. So we talked about that a little bit within the panel, talking about historical legacies and community engagement and what we need to do to address those, to then, for example, uptake in vaccinations or getting the vaccine, seeing healthcare providers, presenting accurate information. So these are some ways to mitigate the spread of COVID-19 for safer and healthier communities.
So our question to you all is, this is just a quick brainstorm. We obviously don't have much time, but please jump in. What could we, and when I say we, I mean all of the different groups that have joined here, whether we're in community and academic institutions, wherever, what can we together through partnership do that might prevent or reduce the chance of an emergency in the future?
I'm gonna say, as far as partnership, just keep up with the times, engage, let people know what's going on. As Mr. Williams said, be transparent. We can only do what we can do, and we only know what we know. But I think if I don't know something, Reverend Rodney or Ms. Vines may know something. So just keep engaged and be transparent and honest.
Great, thank you. Anyone else?
I don't know if we can alleviate emergencies. I think I understand the question, but I don't know if we can alleviate emergencies. Things are going to happen, but I think if there's a structure in place that has all the things that everybody has been talking about, transparency, known partners that can move information in a bidirectional manner. If we have a structure in place that can address any kind of emergency, whether it's an outbreak, whether it's, weather related, whether it's, I think that's what's important, because I think emergencies are going to always happen. It's just having a structure in place to deal with them, and also, if possible, for any kind of forecasting that can be done with regard to emergencies would be good.
Yeah, anyone have other thoughts on that? How would you forecast and build the structures to be ready for this?
I mean, I will piggyback what the young lady just said. I mean, storm's gonna come and events gonna happen, and as long as we're breathing. So, how do you prepare yourself? I really don't know. It's just having a system in place for that. I mean, is similar as having a spare tire in the back of your vehicle. I mean, just in case you get a flat, which we try to call AAA to do it anyhow. But just, I don't know how to really answer that question.
I might add something. Hi, I'm Emily from CCPH. I'm thinking about how we might leverage our coalitions and partnerships to advocate for policy changes. I think really one of the most important aspects of mitigation, and others have spoken to this, is like building these structures, right? And that makes me think of policy changes rather than depending on, individuals to make individual choices, to do prevention, one way or another. I think really what makes the biggest impact is changing policies and structures. And so thinking about, how do we reach policymakers to advocate for things like we need, ventilation in schools, for example, would be really effective in helping us with other COVID and other, potential airborne pandemics. Things like, just making, tests and vaccines more accessible. Trying to alleviate insurance burdens and things like that prevent people from seeking care. So I'm just sort of thinking about how can we leverage all of our partnership building, to try and really focus on those kinds of changes.
Yeah. Any last thoughts on preparing, mitigating, and repairing? I think we're going to move to the end because we're coming up on time. But this was really the part that we wanted to get to in terms of thinking up front for the future. We've all had a lot of experience responding and recovering, and we're still doing that. But this upfront work is really can be really critical, and this is the time to do it. So. Sounds like a lot of you went from mitigation 2 to thinking, no, this is about preparing, planning, organizing, equipping, as well as having those laws and things in place. So I don't know, Keisha.
No, I think you covered it really. It's just kind of, given that it is a continuous cycle, it is important to present with a united front and to have the media, government officials, healthcare providers all on one accord when addressing the emerging pathogen. And so you can definitely do like a community needs assessment or landscape analysis, or present with active listening within the community to prepare for for the pandemic, whether it's PPE or accurate information or watching the news, and identifying assets and barriers within your community. So that all can go within the preparation phase of community partnerships. And you can go to the next slide. And so quickly, just for the responding section, so it's putting your preparedness into action. So some examples of this is language equity, whether that's having communication in English and Spanish or tailored to your specific community, accurate information and dissemination to community members that they can understand, gathering their resource hub so people can go and find out new and updated information, or assessing a risk assessment, and seeing, okay, how can I respond to this, and what is the risk or what are the barriers in doing so? So finding those outlets for potential emergency scenarios. And then you can go to the next slide. And then so for recovering, lastly, consists of those activities that continue beyond the emergency period to restore critical community functions and begin to manage stabilizing efforts. So this is really important, just so to provide a healthy community once the pandemic is over, or once the spread is slowly going down. So I present like this example from Hurricane Katrina, where New Orleans is still recovering from the aftermath of that, and how government officials pay little to no attention to the communities that are struggling from Hurricane Katrina, and how there was a little action being done to rectify that. So just recovering is important within communities to make sure that they are stable and secure once a pandemic hits, since they are the most vulnerable to receive that virus or emergency or whatever. We will skip this slide actually, but this is just a template that you can use within your community that kind of lays out the 4 stages of the cycle. And you can label as goal, strategy, action steps, who is responsible, and the overall outcome that you want to achieve. Next slide. So what are the next steps that come after this event? So we have 2 more forums that are taking place October 23rd and October 25th. And so during the session, we talked about the respect sites and explored how they can collaborate with local community partners. We saw a collective discussion on the 4 stages of the emergency cycle. And we're just going to collect all this information and share it back with you all. So we'll share back with you the recording. And then towards the end of the last forum, we'll share a synopsis of key themes that came out of each of these forums, and then how we can support each other within this work, whether that's resource sharing, additional meetings, building a coalition, email lists or newsletters, anything of that. So feel free to email me with suggestions, and I'll also be adding that within the evaluation in the next slides. So again, I want to thank you guys for your time and honesty and sharing your information. I really want to give a special thanks to our guest speakers who came and talked about their communities, their organizations, excuse me. And so I want to leave this with any other questions that anyone might have, or any feedback that you might have as well. And then we have an evaluation that takes about 2 minutes. Well, in the next 2 minutes, please complete the short evaluation. The first people that will complete the evaluation from a community-based organization will receive $75 just as an honorarium. So please take the time to fill that out, provide us any feedback, and share us your information. And thank you guys so much for tuning in today. Any last questions?
Thank you.
Yeah, like Keisha said, we have 2 more forums, and I think Emily is gonna put that in the chat. It includes our web page, including all the dates and the speakers that we'll have for those 2 extra dates, as well as the registration. So again, thank you so much for your vulnerability and your participation, and we hope you have a lovely day.